Okay. All right.
And by the way, this is being recorded so that you all know that for legal purposes. Okay.
Okay. Well, for those of you that are on, we apologize for all the technical difficulties, and we welcome you to our training here. And this will be posted on afterwards, so let your colleagues know, and they can kind of watch it on afterwards on probably online on our YouTube channels, or we'll make it available one way or the other. But for those of you guys who haven't been able to figure out yet, on the bottom left hand of your screen, there's a couple different little circles. And on the far left, there's one with like a little word bubble on it. If you click on that, that should open up your chat box, and you'll be able to ask us questions throughout the webinar here, and just pop in your questions right through there. And then on the far right of your corner of your screen there, you'll see a few different boxes. There's one where it has a couple different, has like a little person, a little square box there. That'll give you the different views so you can look at it. So that way you can kind of see the presentation and the best view that fits your screen there. Okay. But we'd like to welcome you guys all. And we have today, we're going to be talking about our family outcomes surveys that we've sent out to families and inform you a little bit about that. And we have which is the Early Intervention Ombudsman, and Kina Sims with us, who is the Early Intervention Training Program Project Manager. And then I'm Benny Delgado, the President of the Illinois Developmental Therapy Association, and kind of will be walking you guys through this presentation today. So feel free to ask questions as we're going through it.
So this is Chelsea. Welcome, everyone. Once again, I also apologize for the technical difficulties, but hopefully we will be able to breeze through this information and people will get an opportunity to ask some questions and learn a little bit about our family outcomes process. Kina and Benny and I are going to kind of be trading off for different portions of this, but we're going to get rolling right now so that we can give you some of this information. So hopefully you're all somewhat familiar with the Family Outcome Survey or this process, but if not, we're going to kind of walk you through starting at the beginning. And so this process was really developed by the Office of Special Education Programs, sometimes also called OSEP, who supports a comprehensive array of programs and projects that are authorized by the Individuals with Disabilities Education Act. Their job is to improve results for infants, toddlers, children, and youth with disabilities. And part of this support involves determining the effectiveness of the programs that they support. And so since early intervention is Part C of IDEA, we are one of the programs that they support. And as we know, early intervention is intended to benefit both children and families. So when we're really thinking about the effectiveness of the services and supports we offer through early intervention, we have to think about what changes for both children and families. Using the Family Outcome Survey is one way that we are able to find out about the benefits families receive as a result of participating in early intervention. So when we think about why it is that we want to measure outcomes, obviously there are a variety of reasons. I think the first one is to help us think about how our programs are making a difference for the children and families that we're serving. It provides information that we can use to improve these supports and services. And then lastly, it allows us to demonstrate results to our stakeholders. So obviously when people are investing in a program, they want to know that the results that are intended are actually achieved. And so we want to think about and be able to show everyone what changes for families and children, and we want to be able to report that back to the families who take part in the program, as well as our providers, program managers, and the people that are actually funding the services that we offer. Each year, DHS, who is our lead agency, is required to report on a series of indicators that reflect program performance. The family indicator, or indicator number 4, in the annual performance report describes the percent of families who have found early intervention helpful in knowing their rights, effectively communicating their child's needs, and helping their child develop and learn. These items are further broken down, and so things like useful information about rights, knowing supports and services, knowing who to contact with questions, and knowing options for when the program ends are all kind of subsumed under Part A of this indicator. Obviously, there are individual items under each of these other broader topics, and we'll be talking about those a little bit more here in just a couple minutes. So in case you haven't seen it, here is an example of what the Family Outcomes Survey looks like. It's a two-sided document, and Section A of the survey examines things that may change as a result of participating in early intervention, things such as knowing the next steps for their child's growth and learning, understanding their child's needs, and being able to tell when their child is making progress. So Part A is really thinking about outcomes in the truest sense of the word and really looking at the benefits families may experience as a result of participating in our program. Part B of the survey provides information about how helpful early intervention has been in doing the three things that we identified on the previous slide, and that is the information that gets reported to the Office of Special Education Programs. Tina's going to take a minute here and tell you guys about the last survey for which we have the final results, and those would be the surveys that we sent out last year for fiscal year 2012-13.
Okay, so as Chelsea stated, we're currently in the process of sending and collecting the family outcome surveys for this year. We're going to share some details with you for last year and how it went. We mailed out the surveys with a cover letter and a posted page return envelope to every family with an active IFSP and early intervention. The letters and surveys went out in English and Spanish. We also had an online option for families if they preferred to fill it out that way. That was available also in English and Spanish. There was a link in that letter that they received, and that led them directly to the survey. Also, a family, if they didn't want to fill it out on their paper process or fill it out online, they could simply call the number that was provided on the letter as well, and we would help them to complete it over the phone with a live person. We distributed about 19,247 surveys last year, and we received back about exactly 3,336 family outcome surveys. So just for a little history, for 2010 and 11, that was 2,295 surveys returned, so that number did increase. And as you can see on that last bullet point, we had overall a low response rate, and especially even lower by race and ethnicity, with the breakdown being that 76.47% of white families returned the survey, 8.9% of African American families, and 5.75% for Hispanic families, and this is not reflective of our EI population.
Now, can I ask a question in terms of the online surveys that people can fill out and then also the phone ones? Can they do that in other languages as well, or is it just in English?
Currently, it is in English and Spanish.
Okay.
Thank you.
Yeah, and Benny, that holds true for the written version of the survey as well. The two languages that we have the full survey available in are English and Spanish. And so if another, reminding Kina, if another language is identified as the primary, those families get English surveys. Is that correct?
They would get English surveys, and then they would hopefully have an interpreter in the EI system that's helping them with their services, and that interpreter might be of some assistance to help them with the survey. We would make sure that we could accommodate them in any way that we could if they called us, or, however we can support them.
Right. So that's probably an important detail, Benny, for thinking about our provider and service coordinator pool, is if a family writes who can't understand the language of their survey, certainly if they can call their service coordinator or their provider, they can direct them back to the training program phone number, and we will work with them to get their survey completed.
Yeah, so I think as providers, it'd be, for those of us that are on here, and as you're talking to your, colleagues, so that we are able to capture the feedback that all of the families in our system, or the greater majority of the families in our system, are participating in this survey. It would be good for us to kind of use the interpreters that were there with us to kind of remind them and let them know the importance of the survey so that they can kind of give their feedback.
Right, and so we certainly don't want a family speaking a different language to be a barrier to their completion. And so certainly if you have families that are expressing that as a challenge, be in contact with the training program and we'll work with them to see if we can help them out. We want to kind of move on to the results from last year's survey, which is the one that Keena was just describing for all of you. As part of our reporting process, states are required to set performance targets. So essentially we've been asked to predict how well we're going to do for a number of these indicators. Some of them are compliance indicators, and so OSEP sets the targets for those. But a fair number of the indicators we used past performance to project what we thought things might look like in the future. And so as you can see from the chart above, so the blue column indicates the target that we set for last year, and then kind of the yellowish green line indicates our actual performance. So you can see that we didn't meet our targets for any of the family outcomes indicator items. One thing that's important to note, however, when you're looking at this is that when Illinois originally set these targets, we were using a different survey and a different method for calculating positive responses. And the reason that we actually changed the survey and the method is because we actually felt like a better survey came along that would provide better information about families and provide more specific information for program improvement. And so just for instance, the original survey that we based these performance targets on only had 7 questions, and so it was really difficult to tell when families responded either positively or negatively where kind of the breakdown in the system was actually occurring. And so a new survey was developed with a lot more detailed items, and so Illinois wanted to be able to use that survey in order to get more fine-grained information about our performance. In just a minute, we're going to look at methods other states have chosen for obtaining this information, and we'll talk a little bit about their performance as well. One thing you can see, though, from this chart, which shows Illinois' specific performance across the last 3 years, is that our performance across time is relatively consistent. And so what you can see is down here on the bottom are each of the 3 indicator items, and then there are actually the numbers of actual performance here listed in these columns. And so though there have been some slight fluctuations in the performance across time, looks just a little bit different across each year. In general, about 3/4 of the families who return the surveys each year report that EI is helpful in each of these 3 areas. So as I just mentioned, states have the option for choosing how they obtain and report this information. As I mentioned also, Illinois changed their methodology for measuring this indicator after our targets had already been set. This graphic will help you guys kind of understand what different states are using in order to gather this information. And so what you can kind of see, I'm not sure how large this is on your screen, but the brown states are using the Nexeme Family Survey. And so you can probably tell from this graphic that is by far and away the most popular measure for gathering this information. You can also see here the dark green states. Those are the states that are using the original Family Outcome Survey, the one that I just referenced, that has fewer items, and is actually the one that we were using when we set our original targets. You can also see here the light green states are the states that are using the same methodology that Illinois is using. So they're all using the revised Family Outcome Survey. And there's a fair number of states, I believe 9 or 10, that are using this method as well. And then lastly, you can see these blue states are states that have chosen to develop their own survey for gathering this information. So this is just kind of important to keep in mind if you're looking at other states' information or national data. Recognize really that other states may be using different approaches to collecting and gathering the same information. So you may or may not really be comparing apples to apples.
Are there any particular, I'm sorry, Chelsea.
Go ahead.
I was just going to wonder, are there any particular, in that last graphic, are there any particular major differences in the way that we provide our survey in comparison to some of the other ones?
You know, I think there's a slide coming up, Benny, where Kina talks about, or at least it shows on the slide, the different ways, not only the different, this graphic shows you the different surveys being used. In a couple slides, we're going to show also the different methods for collecting that information. So the answer is yes. I mean, there are not only different surveys, but different approaches people are using to collecting the information.
Okay.
So in order to really kind of think about comparing apples to apples, ECHO, the Early Childhood Outcome Center, which is now part of the Early Childhood TA Center, actually developed a graphic so that we can compare ourselves to other states that are using the same survey. Now, once again, this doesn't necessarily mean, like Benny just mentioned, that they're using the same methodology for collecting the information. So they may have a different nuances to their process, but at least they're using the same survey to collect the information. And so you can kind of see Illinois' performance relative to the other states that are using our same survey. So Illinois here in blue, the other states using the similar survey are here in this yellowish greenish color. And I think when you look at these, you can kind of see that Illinois is kind of in the ballpark here. So even with regards to knowing rights, we're within 5 percentage points. Communicating needs is much closer. And actually for helping children develop and learn, Illinois' early intervention program is assumed to be, or reported to be, more helpful than some of our similar states here. That picture changes, as you can see, when we really look at our results specifically compared to the national trends. And so nationally, using different surveys, we get much higher results here for those that are returning surveys. And so just as an example, other FOS or Family Outcome Survey revised states for knowing their rights, you may remember from the last slide, tend to report 82%, whereas you can see using a variety of other methodologies and surveys, people are reporting higher results here. Not much difference in communicating children's needs, but in terms of helping children develop and learn, you may recall Illinois was 87%, other similar states is 84%, but the national average is 91%. So this is really just a cautionary tale to say that when you're kind of looking at Illinois compared to national results, you have to keep in mind that how people are collecting and calculating these numbers may be different than what we're doing here in Illinois. So one of the things we thought Benny could help us think about is when we looked at last year's survey and we broke it down by individual items for Part B, there were 3 items that were ranked, higher than some of the others, and 3 that were ranked lower than other items. And when we really think about providers and service coordinators and system stakeholders' role in this family outcomes process, we wanted to let people know where families are reporting we're kind of doing better or worse, because obviously those are the items that we have the opportunity to impact. So I think Benny's going to take a minute here and kind of think about some of these items and talk about maybe how he addresses them or how others might be able to address them in the context of the services we provide.
Yeah, and I think, I always find it helpful, and, as you guys have questions, like I said, go ahead and pop them in that chat box. Again, it's in the bottom left-hand corner of your screen there. There's a little blue circle that you click on to be able to chat. But I always like to use the collective wisdom of everybody here to kind of give input on how we can kind of make an impact as providers, either service coordinators or, speech, OT, DT, any of those providers in there. Yeah, I think when we're looking at some of the lowest rated items on the right-hand side, when it talks about giving useful information about available options when your child leaves the program, I know in talking to the families, oftentimes, they know about the, early childhood program that comes next in school, but they also sometimes want information about additional resources that are available in their community that they can kind of connect with to be able to support their family. So sometimes it's talking with families about adjunct services that they can get. So finding the other service providers in the community, whether it's other clinics that are around or hospitals, where they can get ongoing services. Especially I find that often with families who have all kids and they're trying to find other programs that are out there. So definitely becoming familiar with the programs that are available in your community that you're serving. The other option right there, the next bullet point talks about, again, talking with other services or people who can help the family. And so again, same thing. I mean, talking about other type of programs that are out there. There's also things like the Parents as Teachers programs, Lecotech centers, a lot of other type of things that are out there to be able to help with community programs. And then this third bullet point really talks about, having children be able to get along with others, and oftentimes I find that if we haven't had a chance to be able to get out into the community, this may not be something that families really kind of get a chance to experience, to kind of see what it's like to have their child interact with other children. Oftentimes they have multiple services and they have a lot of appointments, whether it's doctor's appointments or appointments with service providers. And so there's there's limited opportunity to be able to get with children in the community. So definitely I try to get an opportunity to be able to get out to community settings. If we get a chance to be able to go to the library or to the park or sometimes to the mall, different places that are out in the community, so that they can see their children interacting with other kids. Definitely this is something that's built in if you're going out to the daycare settings, which may be helpful for us to kind of give parents feedback on how they're interacting with their children.
Right. And so, Benny, there's some discussion going on here over in the chat box, and people are noticing that one of our highest rated items is giving useful information about services and supports for you and your child, and then ironically a lower rated item is connecting you with other services or people. And so I think, Kay, your point is well taken. We may many times or at least sometimes give information, but right, actually making sure that the program's a good fit, making sure that the family can qualify for the services offered, making sure that we're not, having families spin their wheels for programs that aren't really the same as the ones that they were trying to identify, as Benny was just discussing. That may be a little place where we have a disconnect. And so I think that certainly that's something also that may be reflected in another lower rated item, giving useful information about available options when your child leaves the program. The presenters and I talked a fair amount about kind of how does that play out. And so I think what Benny was saying, many times we have strong support for helping families transition from Part C to Part B preschool, which is early childhood special ed, but we don't really think about connecting families to a variety of other programs. And so I think Benny mentioned a number of them, but thinking about, right, is there an option for a family maybe to dually enroll in early intervention as well as early Head Start so that then they transition on to Head Start? I think another thing is really thinking about connecting families in the early intervention time range to programs and services that will live beyond the length of time a family can be involved in early intervention. And so, right, I think that your point about actually making those connections, whether that be because families need resource help, say a phone line or an internet connection or things like that, or making sure that the information we give really matches what it is the family's seeking is a really important point here.
Yeah. Mm-hmm.
So I'm watching our time, and folks, we're going to have a really difficult time getting done right at 9:30, but bear with us. We're going to try and cover as much as we can here, but we wanted to show you just the difference here between Part A and Part B. And so, like I said, Part A, the items that Benny just reviewed, are really talking about the helpfulness of early intervention in doing a certain series of things. The items that I personally am more interested in are really these outcomes, so things that actually change, skills the family actually leaves our system demonstrating or able to do. And so, Benny, can you take a couple of these, maybe things that really ring true for you here, either on the highest or lowest rated items, and think about, right, how we demonstrate that. And I just wanted to say to folks, we do see the other questions that are coming in, and we're not overlooking them. We'll get back to them here shortly.
Yeah, certainly. So, I mean, I think if we start with that first bullet point and talking about at the highest end, able to tell when your child is making progress, I think this is something that we tend to do well with as we're reviewing oftentimes in our meetings, in our 6 month meetings or annual meetings and having that discussion with families. I think on the other end, when we're talking about some of the lowest rated items, when we're looking at, knowing next steps for our child's growth and learning, sometimes I think when I think about the services I provide, even, we lose track of doing some of that ongoing assessment with families. We kind of do our assessment sometimes initially at our annual. We're working definitely on our, outcomes, but as part of our conversation and engaging the families, sometimes we may kind of miss providing kind of what those next steps are and kind of continually measuring how the child is doing in the services they're providing and what are next steps, what we should be looking for next as the family's kind of goals and priorities continue to change. Um, we talked a little bit about some of those other options when a child is leaving the program a little bit as well. Um, I think this other bullet point that talks about having families talk to others who have children that are similar or who have similar needs. Here's another opportunity where I think we can kind of really get a chance to make parent-to-parent connections, working with our service coordinators, to kind of help identify some other families that may be able to connect with families so that they can kind of have that shared experience. Um, Looking at other support groups that might be in the community, definitely making use of our parent liaisons that are in the system to be able to help with those type of things, I think are always important. And
Right, and I think, Benny, didn't we just talk the other day in a work group too, and thinking about activities that particular LICs or CFCs may be sponsoring for families as well, and sometimes those can be a great opportunity for families to meet other families whose children have similar needs.
Mhm. Absolutely. I mean, and I know I'll check with your CFC about some of those type of things. I notice more and more of those things kind of going out on email sometimes. So you'll see like, hey, providers, we have an upcoming play group that the CFC is sponsoring, or sometimes a talk for families. Definitely check with your CFC about those opportunities and share them with your families, because that's an excellent opportunity to be able to connect with other families that are going through similar experiences. Um, the other couple of things on there, I think it seems like we do a really nice job of, having a little bit of connecting with families around having them feel like they have support around them as well. So like, it talks about having friends and family who listen and care. I think that kind of ranges, with the family members that they're working with, and making sure that we're involving them into our process as well, so that everybody has time to kind of reflect on, what's going on with the child and providing support and kind of building the network of support for families. Um, and I think the other option I think that is important for us to look at as well is kind of checking in with some of the other type of religious organizations, finding a lot about some of those things that are going on in the community. I know in my area there's certain religious organizations that have specific programs for children with special needs. They have certain ministries for that, and those are definitely nice things to know about and be able to share with families, because sometimes they feel that they may be isolated and not have a chance to kind of uh, partake in some of those opportunities.
Right, and so I think here, right, what families want to participate in, we have to acknowledge may be different for each and every family, but I think through some of our family assessment questions, and certainly as you come to know your families through ongoing early intervention, right, finding out what's important to them, what do they participate in, what might they like some support in participating in, and thinking about what the role is for us in helping make those connections. So I think Keena's going to step in here real quick and talk to us a little bit about this year's survey. And while she's doing that, she's going to address some of the questions that have been coming in through the chat box as well.
Okay. So again, this year for the Family Outcome Survey, it was mailed to all families with an active IFSP at a point in time. And that point in time this year was February 28th. So if a family was in an intake process at that time, they will not receive the survey. So if you ever have families to come to you and say they didn't get one, they may have been in the intake process, and that could be a reason why. We distributed 19,967 surveys. Approximately 1,700 were returned to us as of April 25th, and I checked again this morning, so for hot off the presses, our numbers have reached 2,100 surveys returned. So we have a ways to go, but we are looking to, of course, collect several more surveys over the next month. Again, we're keeping in mind our challenges of the low response rates overall, especially by race and ethnicity. And again, the low ratings that we discussed on the previous two slides as well.
Right, and so I think another thing here too is Kina will be sending out our reminder about the survey here in the next couple weeks, right?
Yeah, that's coming.
Yeah, and so families should have already received the initial mailing, but they will be getting another copy of the cover letter, the survey, as well as another postage-paid return envelope. So hopefully you'll be hearing families talk more about that, and hopefully you can encourage them to either return the paper survey or use the link that's provided in the cover letter to respond online. And then just this is the piece that I was talking about earlier when we talked about the different surveys that states are using. This graphic demonstrates that there are a variety of ways that people are collecting the information as well. And so for those of you who have been in the system for a while now, you may remember that a long time ago we actually used the first methodology here, and we provided in-person distribution. And so at that time we sent surveys and cover letters out to all the CFCs. We asked service coordinators to hand deliver the surveys to families in the context of an IFSP or some kind of review or ad meeting. And we were realizing that we were having difficulty getting the surveys into the hands of families. There are some states that still use that as their methodology. Some states also collect it back via this in-person method. Some allow people to do online, so it's just distributed in person, returned a different way. And then some use the method that we originally used where they distribute it in person, but then people mail back in their responses. There are some states that use multiple distribution methods, and then you can see on the bottom there are a fair number of states that use the mail distribution, which is the process that we use and that we've been describing so far. So Kina, you want to talk a little bit about some of the changes that we've made this year in trying to address some of our past challenges?
Absolutely. So we're always looking for remedies to address the challenges that we face. So we brainstormed, heard from the field, consulted with the Child and Family Outcomes Work Group, and we've come up with some potential remedies. What you're seeing on your screen right now is a picture of the envelopes that we sent out this year. We wanted to make sure that the envelopes stood out to the families and that it was, in fact, family friendly. So last year, it wasn't the baby on there. It just may have looked like any piece of mail. We wanted it to not look like junk mail so that families would be drawn to it and want to open it. So that was one of the things that we thought of for a potential remedy. We also heard from the field that last year some of the translated letters that we sent to the families were not quite as family friendly as they could be. So we had everything retranslated into the Spanish language, and that included the letters that went out as well as the online survey, which included the directions and the questions that were on the survey as well. So we did a real nice overhaul for that. And we also now have a designated phone line for just Spanish-speaking individuals so that they can ask questions and complete their surveys online, over the phone, more easily with someone live that speaks Spanish. The families will even get a Spanish voice message if their call was missed, because we've experienced lots of hang-ups, of course, when there's an English-speaking person that answers or an English-speaking voicemail. Also, all the letters that are sent to the family and even to the field, giving reminders to CFC managers and things like that, came from the Bureau, from Miss Amy Tarr this year. And it just urges, the CFC managers to remind service coordinators, providers, parent liaisons, LIC coordinators, whomever can help to spread the word and encourage families to complete and return their surveys. Some of the other remedies that we've tried and that we are trying are robocall reminders to the unrepresented populations that we spoke about before, both in English and Spanish. We made announcements on virtually every EI newsletter, as well as website, including the training program, Clearinghouse, Provider Connections. And as Chelsea mentioned before, in the past, we've sent out a reminder postcard to families, but this year is the first time that we're going to send the entire letter that they originally received, as well as the survey, again, to families who've not responded. So in the past, when we sent the postcards, it would say if you have not received it, or if you need another one, give us a call. And that was just more time consuming. They would have to wait for us to mail it again and things like that. This way, they're getting the survey fresh again, and they can just simply complete it in whatever manner they want to and send it back. So just please urge your families to look out for another survey coming in the mail, look for that baby on the envelope, and return it as soon as possible. And one of the most important remedies that we keep in our mind is for us to really work together as providers and service coordinators and EI interventionists to make sure that families know their rights, how to help their child learn and grow, how to access resources, as well as make sure that families are aware of their options for transition when transitioning out of the EI program.
Thanks, Kina. And so I think what we want to do is just highlight, and Benny, I think you were going to take this one, anything that you felt like we didn't get to go over on those prior slides. But since we had such a captive audience, we really wanted to think about the provider's role in supporting families, so that when we do hear back from families that they really are achieving the things that the program is intended to help them with, and that they're getting the information, the help that they need. So are there things here you want to go over again?
Excuse me. I think really the main thing to take away from this is that this is one of the measures by which we identify, or determine kind of how effective we are in our program and the services we provide. And so as providers, I think it's important for us to kind of be mindful of that and become familiar with the surveys, some of the items that are on there, and kind of how does that translate into some of the work we do with families. So keeping in mind, like we said, making sure that we build that support network for families around them, get them involved in their community, know what resources are out there for them, and be able to really address the priorities that they have for their children within the context of some of their daily routines and things that are important to them. So I think it's important for us to be mindful of that and be able to support that so that we can make an impact on the results of those surveys as well. And then also just, continuing to remind them that their feedback is really important. As I've been talking to families, about the surveys that have gone out to them, a couple of things that I hear back is like, oh yeah, somebody else gets the mail for me and it's kind of mixed in with a couple of things. I have to go look, and just kind of being mindful about reminding families that those surveys are out there and that we really need their feedback, that it really helps drive, how we provide services to them.
Right. And so I've seen even in our chat box, some people have been suggesting some strategies for how we might get more people to respond. I do think, I see some people that are saying, can we have the service coordinator complete the survey? And I think that that's something that the work group has talked a fair amount about. We wanted to make sure that families felt comfortable expressing their opinions openly and honestly. If they'd experienced challenges in the system, we need to hear from those families so that we can work on system improvement. And so we've always wanted to make sure that families had, an essentially anonymous way of responding, and we didn't want them to feel uncomfortable providing honest feedback, and that's why we have skirted away from the in-person return methods. I think that's something always that we're thinking about, though, in the work group, and so that may be something that we revisit, but we certainly want families feeling comfortable to answer the survey honestly, and also to use the comments, which we haven't even talked about yet, the comment area to provide feedback about what worked or didn't work for them. Let's see, Kina, were there other things that you saw in here that we should be addressing?
There was a question about once the data is received and analyzed, where does it go and how do the local areas of the state learn about the Illinois data? So what we do is when we receive that data and it's analyzed, we send out to every Child and Family Connections in the state their local results. And we ask that they share it with their service coordinators and staff, as well as their providers that they have a relationship with, and anyone in their community. We also, of course, are putting it in our annual performance report, and that goes out to the state. But we're trying to make sure that we do localize it so that CFCs can get their own data and kind of know how it affects them personally. We're working on and having talks about how we can get more of that data to providers so that they can really see their impact as well.
Right, and so hopefully if you go to your CFC's LIC meetings, or if your local CFC has provider meetings, our hope is that we're sharing that information back with their provider pool. And when Kina sends that information to CFCs, it's all the way down to the item level. So an individual CFC can look and see for those items that Benny reviewed in terms of those ranked highest and lowest. They can see if those patterns hold true for their CFC as well, or they can see if they did better or worse than state averages on certain items. And so once again, the idea is not to just be collecting this information for collection's sake, but to really think about what are we doing in the system that is or is not working for families, thinking about our practices and how we might improve results for families. Kina, I also see there's a question here about when the surveys are due, and so since the people that are listening to the recording won't see these questions, you want to go over the answer to that one?
Okay, sure. Yes, the surveys are due by June 30th of this year. And so, of course, we're going to send out another mailing. They're going to have, a good month and a half to get that back to us. But June 30th is going to be our cutoff date.
And so, right, hopefully you guys will be hearing from families that they've received a survey. If they did, certainly encourage them to either return the paper survey or use the link to complete that survey online and get those back to us promptly. Kina, you see that next question there?
Yeah, I see a question about what happens to non-English speaking families. Are there surveys sent in that language? We mentioned that the surveys go out to families in English and Spanish. If there are other languages that are represented, we mentioned to contact their local CFC and try to have them connect them with our program, the EI training program, and we will accommodate them with the other language and find an interpreter that could help us to allow them to fill out the surveys with us either on the phone or in some other capacity, since there are various ways to fill that out.
And so, Kina, there is a number for the training program in the cover letter that went out to families. Is that correct?
There is. That is correct. And there is a number for the families in Spanish, the ones that get the letter in Spanish. There is a specific number for those Spanish-speaking individuals. And then there is also a number, two numbers for the English-speaking individuals, which is just our 1-800 number that is found online, as well as the 217-244-2608 phone number. I can pull that other number up for you. for the Spanish-speaking individuals, and I'll get that to you right away.
Okay. And so, yes, there are options for families. They can contact the training program, even if it's an English-speaking family but may have difficulty accomplishing the survey due to reading level or difficulty understanding terms. Certainly they can call the training program, and we will assist them in completing that survey. One of the most important things is just for them to have the paper copy of their survey so that we can actually get the survey number from them so that we can link the information correctly. See, a couple people are typing, so I'm sorry to be stalling, but just want to get a...
Just before we move on, I'm sorry, Chelsea.
Yep.
I just wanted to say that number for those Spanish-speaking individuals, that is 217-244-3558. And just to reiterate the number for the English-speaking individuals, it's 866-509-3867 or 217-244-2608. And that is on their letter that they receive.
Okay. And so maybe providers can just remind them about the pieces that are on the cover letter, because I think if families read through that, certainly the information they would need in order to complete the survey, regardless of language, those instructions should be in there. So I see another comment here about some other suggestions in terms of methodology for distribution and return, and certainly Keena and I will be taking note of that and bring that information back to the work group. I'm looking at our time and realizing we're 20 minutes past what we said we would do, so I apologize for that. Hopefully people have been able to gather a little information. We are so very sorry for the technical difficulties. As you can imagine, it's a work in progress, and we've learned a lot from the challenges that people experienced today. Sorry you had to be the guinea pigs, but we will certainly correct things going forward. Benny, is there anything you want to share with folks before we go?
Just again to thank them for participating today, and we hope that they'll share this information again with their colleagues, let everybody know about it, and hopefully we'll have some links up for them to be able to come in and watch this again, and keep reminding those families about the surveys that are coming out to them. We hope to get their feedback.
Right, and so I will work with Lucy. Certainly everyone who participated will get the information about the posting of the webinar recording and where they can find that. But hopefully you can share if you run across colleagues who had attempted to get on today and experienced challenges with their technology or the information they received, direct them back to that as well. But hopefully everyone who registered for today's webinar will be getting an email to talk about how they can access this information. And then I know Keena's been taking attendance. Keena, what's the process for them to receive their credit and their certificates? Can you just go over that before we start losing folks?
We have taken attendance, and I have everyone's name down that either wrote their name in the chat book or their names appeared under the attendee list. And we are going to get that processed at the training program and have your certificates emailed out to you as soon as possible, and you will receive credit for the entire hour as promised.
Okay, so once again, thank you so much for joining us. Thanks for your questions and your attendance. And your attention as well, sorry. If you have additional questions, we've put everyone's contact information up here. And then also thinking about future opportunities for training and information, we've included the websites of the presenters as well. Thanks again, and we hope to talk to you all again in the near future.
Thank you.
Thanks. Bye.
Goodbye.
So, Keena.